it's Luisa Lyons here, midwife and lactation consultant with No Milk Like Mamas and tongue tie practitioner. So here's a little video for you about tandem nursing. So tandem nursing can mean when you're breastfeeding when you're pregnant, so breastfeeding an older child when you're pregnant with a new baby, or it can also mean breastfeeding a newborn baby as well as an older child. So it kind of refers to both things. So if we look first at why on earth you would tandem nurse, because some people still think it's a very unusual thing to do. Some of the benefits are that it might ease the transition of becoming an older sibling to your older child when you're pregnant and when you have a new baby. It's a highly emotional experience, obviously, for your older child when they gain a new sibling. Emotions run high, so it may make the transition smoother, and certainly a lot of parents who have tandem nurse, their mothers have said that it did help ease the transition and also ease toddler tantrums and issues with a new sibling. The physical benefits obviously are there in terms of immunity and also in terms of nutrition, which don't go away. So the benefits of breast milk nutritionally and for immunological benefits don't disappear at a certain age, be that 6 months, 1 year, 2 years. It always has health benefits. And there's, as well as the physical benefits of immunity to the older child, it can ease teething pain for older children and also, as I said, ease tantrums. And in terms of comfort for you as a mother, it can help to ease pain and engorgement associated with when your milk comes in. So if you have an older nursling helping to drain your breasts effectively, that can help with engorgement as well. And also it helps to protect your milk supply and milk production, particularly if your newborn's a bit sleepy and reluctant to feed. So there's some of the benefits and the reasons why you might like to consider tandem nursing if it feels right for you. You might feel you're drawn to different options on different days. So if you're pregnant and considering whether to continue breastfeeding, if you're pregnant with your older child, or if you're considering whether to continue after pregnancy when your newborn baby has arrived, then just know that it's really normal to feel different emotions, thoughts and feelings about it on different days. So you might feel one day that you want to do one thing and one day that you want to do another, and just know that that's a very common experience that is reported by mothers. So in terms of any risks to it, there usually are no risks for most people to breastfeed during pregnancy. However, in very small numbers of people there can be risks associated. So if you do have a history that worries you, then please get in touch with an IBCLC so we can give you tailored advice to your individual circumstances, and obviously discuss it with your obstetric consultant if you have a very high risk pregnancy or particular risk factors. But for the majority of people, there are no particular risks that have been found in research. As a note, pregnancy may well cause your milk supply to drop. So if you're breastfeeding your older nursling, then when you become pregnant, you can find that the progesterone hormone produced by the placenta as the baby's developing can really reduce your milk supply for some people. And it can often make your nipples and breasts quite sore and tender. Often one of the most common first signs of a pregnancy is nipple pain, nipple tenderness and breast soreness. So this does affect quite a number of women who are breastfeeding, who are then pregnant with a second or third child. So just to be aware, if that happens to you, you may not want to carry on breastfeeding, or you may want a short break while the particular discomfort of early pregnancy is there, and you might find then your breasts and nipples become more comfortable and pain-free as you enter the second or third trimester. So I have known people over the years that didn't breastfeed for the early part of pregnancy because they didn't want to. They had feelings of aversion or agitation, which is again really, really common generally in breastfeeding a toddler, but also particularly common in pregnancy. So you can always pick it up again later if you wanted to. So aversion, as I said, is quite common, and that's when you feel, some women describe it as being touched out or overwhelmed by physical feelings, some people describe it as a skin crawling sensation, and it's not limited obviously to tandem nursing or nursing a toddler. Breastfeeding aversion can affect women at various times, and it's usually hormonal and cyclical. But again, this is a subject for another video. But if you do have issues with what you think might be breastfeeding aversion, please do get in touch, because there are things we can do to help. We have a whole section on that on the No Milk Like Mama's website, and an e-learning course and support available. So just know that aversion and agitation is really common with tandem nursing. Also to say, pregnancy may change the taste of the milk. Some people do describe that their toddler, their nursling, says that the milk tastes different. So just know that that's a really common thing as well. And the reduction in supply and the taste change for some often means that a lot of older nurslings self-wean during pregnancy when the mother's pregnant again. So that's a very common experience as well. But some children nurse more, some children nurse less, as I say, or stop. In terms of what to expect when your newborn baby is born, you'll still produce colostrum, triggered by the removal of the placenta. So you might find, obviously in late pregnancy, you're producing colostrum as well, and that will increase in volume after the birth, just like it did for your first baby. So just know that the colostrum has a laxative effect. So if your older nursling is drinking the colostrum in late pregnancy and early days after birth, they may well have much looser stools. So that's something to expect. Your milk will then change just as it did before, from colostrum for the first 3 to 5 days to transitional milk and then mature milk. And you'll need to nurse as you did before with your newborn baby when they were little, for at least 8 to 12 times in 24 hours to protect your newborn baby's intake. One of the concerns that people often have is how they can protect their newborn baby's intake if they're also feeding an older nursling. And the general advice is to always feed the newborn baby first to ensure that they're getting enough for their needs, and then the older nursling can feed afterwards. However, some people do prefer to feed at the same time, and I have known people over the years have one breast for the baby and one breast for the toddler, and that's an option. Or some people prefer to nurse the newborn first and then nurse the toddler afterwards and have separate time with each child. So it's very much a personal decision. There's no right and wrong way to do it. So we recommend, as I say, feeding your newborn baby first. Sometimes you might need to distract your older child if they want to feed at the same time and your newborn's having any struggles in the way of slow feeding or slow weight gain. And just watch those feeding cues in the newborn baby. You'll have to take your mind back to all of those early feeding cues that you learned about with your first. You may well find that your toddler nurses more frequently again, which may mean that they lose interest in solids for a short time, and that's, again, really common. So if you're feeling overwhelmed, which again can happen, do make sure that you feel you can put some boundaries in place, some breastfeeding manners perhaps, and some clear boundaries to protect you as well, as much as anything. You might feel lopsided physically if your newborn is not draining your breast as fully as your older nursling. So just to be aware that you may feel that one breast is more lopsided than the other, but usually this will obviously even out if you then offer a different breast at the next feed for the newborn. And also it is worthwhile practicing positions before you go out the house and tandem feed, just so that you feel more confident before you go out and feed, if that feels right for you. Be aware of the potential also for fast milk flow. So breast milk supply tends to increase with each baby that you have, and often a fast flow can go with that. So if you are suffering symptoms of rapid milk ejection reflex, so that's your baby coughing, spluttering, choking or pulling off the breast, or all of those, then do get some help, and we can give you some pointers on how to reduce rapid milk ejection reflex. So just be aware that that is a potential there if you are, it's potential for anybody anyway, first baby, second baby, whatever, but a slightly higher potential for tandem nursing. And lastly, just to say, it can be a really emotional roller coaster. So just know that your feelings are really, really important, and make sure you seek help for yourself in all of this as well, and a safe space to talk through your emotions. I hope that's helped, and good luck.